Hello, dear nursing aspirants. Welcome everyone to the Master Nursing Classes Wildfire Session 2. Students, yes, all of you know that in the Wildfire Session 1, we have discussed the very important and trending topics that is on the Men 1 syndrome or Men 2 syndrome. What all are the glands involved in the Men 1 syndrome and Men 2 syndrome? And very importantly, we have discussed the how to calculate the Glasgow Coma scale and how to calculate the GCSP score. What is the importance of the AVPU score? We have discussed everything in detail and we have discussed the very importantly a basic related to the decorticus positioning, decerebrate posturing. So very importantly trending topics, those topics that may definitely comes in your exams, we have discussed in the last previous class and in this today's session, the wildfire session 2. In this particular series also we are going to discuss that brainstorming sessions, that fruitful sessions, so that is giving you a huge knowledge, okay, within a short period of the time. So be connected with the master nursing classes, this wildfire session class 2 till the end, so you will be getting a bulk and fruitful knowledge that you people can't imagine. Also I am discussing those kind of the questions that may confuse you in the exams repeatedly. I am discussing those questions that may create the confusion between the two options in the exams when you people are sitting in front of the computers. So I will discuss those very important questions that may definitely strike in your exams. Bacho, be connected with the master nursing classes till the end, till the date of your exams. I am giving the very updated content that may help you in the exams. Without wasting the time, we will start the today's class. Very good evening, Bacho. Welcome once again to Master Nursing classes. Yes, without wasting the time, we will start the today's sessions. Before going to the main session, there is beautiful motivational quote for everyone. So, what this triple D stands here? What the Nagraj sir written here on the board? Sir written very simple formula for your life, students. That is the life changing formula. You people are adopting this formula in your life. It will change your life. What first D stands, what second D stands, and what third D stands here. First D stands here as a desire. First D stands here as a desire, means the internal craving. You people should and must have some desire in the life, some clear cut goal in the life. So where you want to see after 5 years, 4 years, 3 years, 2 years. So that particular clear picture people you should have in the mind. So then only you people can achieve something. The first D stands here as the craving or the desire. Then last D stands here as the your destiny, where you want to become. You want to become a nursing officer, you want to become a nursing superintendent, where you want to become a senior nursing officer, where you want to become a tutor in the college of the nursings, like central government. So I'm talking about where you want to see yourself, that is your destiny. But so in between these two D's, there is one more D, that is the, yes, very importantly, in order to come from the desire to the destiny, you people must and should have the discipline in the life. So that the discipline including the reducing your excuses. Yes, today I got fever, I don't want to study. No, this kind of the attitudes won't work for the exams. If you are still having the fever, you have to sit on the bed and you have to study. That brings you from desire to the destiny. That is the discipline. I think you people know the story of the Rishabh Pant who got to the car accident. Okay, he was holding the crutch in the both hands and walking. Now he is holding the bat and wearing the gloves and making the wicket keeping for the Indian team. Now he is smashing the sixes that is out of the ground. He never excused himself. And now he is the costliest player in the IPL who went for the around 27 crores. So that is the thing where you have to transform yourself. Nothing is impossible. You are when you will say I am possible. Okay. So remember, nothing is impossible. The motivation will not work. Students, you have to be disciplined for cracking the exams. Remember in your minds. Okay. So we'll start the today's class. That is the first question of the class in front of you all. That is from the psychiatric subject. Repeatedly striking questions with examples and confusing. So I will clear this concept in such a way that you people never ever forget this concept in your life. Okay. So the question is very simple. That is the which of the following is the example for the counter transference? Among given four options, which is the example of the counter transference? The question is asking very simple. The option A stating is that a patient begins to see the therapist as a father figure and becomes overly dependent. Means patient is throwing some emotional responses on the healthcare provider in the option A. Okay, patient is begins to see the therapist as a father. Patient is telling the therapist who is giving care to me, he is looking like my father. He is telling, means the patient is showing some emotional responses towards the healthcare provider. This is what we call as the transference. Bacho. We call this option A as a transference. This is not a counter transference. I am eliminating this one. Then come to the option B. Yes, a therapist feels frustration and irritation towards the patient who reminds them of a difficult sibling. What happened here? The therapist is showing some emotional responses towards the patient. This is what we actually called as the counter transference. Bacho, very simple difference between the transference and counter transference. Counter transference is the, yes, the healthcare provider shows some positive or negative emotional responses towards the patient. That is called as the counter transference. Positive counter transference emotions like the therapist may get involved into the social relationship, some economic relationship. This is the positive counter transferences. This is the beyond the therapeutic relationship, and it is not context in the context and in the boundary of the relationship. Very importantly, you have to remember that the counter transference is the healthcare provider showing some emotional responses to the patient is the counter transference, and the patient is showing some emotional responses to the healthcare provider is the transference. So option B is a clear cut example for the our counter transference here, where the healthcare provider showing some emotional responses towards the our patient. Okay, that is the counter transference. So option D, that is the therapist listens attentively and remains natural throughout the therapy. So this is the natural technique of the, or this is the normal technique of the nurse patient therapeutic relationship. This is the natural and normal process. So option C is that a patient becomes resistant to discuss certain topics. Patient is not interested to discuss certain topics. So this is the example for the, again, yes, the resistance bacho. Okay, so there are three therapeutic impasses there are there in the psychiatric, that is repeatedly striking in the exams. Okay, you all you people have to understand is the, that is, yes, one is the counter transference. In the counter transference, what happening? Primary health care provider, he is showing some emotional responses towards the patient. This is the counter transference. Then what is the transference? Transference is the, yes, the patient showing emotional responses towards the primary health care provider. This is the transference. Then come to the resistance. What is the resistance? Resistance is while terminating the therapeutic relationship, the patient shows some symptoms which is like uncured. All symptoms becomes relieved in the patient when the patient comes to know that now the nurse will start to leave me, the healthcare provider will start to leave me. So that kind of the situation, the patient returns his all the symptoms. The symptoms will come back again. The patients unknowingly shows the symptoms back again. So that is what we call the resistance. Okay, so very importantly, you people understand that the resistance is the, yes, it is the block in the communications, it is the block in the nurse patient therapeutic relationship where the patient begins against all the symptoms back. So that is the resistance. Okay, transference, counter transference is very much clear for you all, I think so. Okay, so the answer for the first question goes to the option B. Yes, almost all of you have given the correct answer. That's, I'm very proud of you all. Okay, yes, the next question is again from the psychiatry. Okay, so do read the question. So this question they have asked in the NORCET 6, NORCET 5. No one discussed it, but I am here to discuss with the history of everything. Okay, so don't fear when the master is here. Yes, very nice. So we'll start. Yes, so that is the question is very simple. The dementia precox is now known as which of the following disorder? There was a disease called as the dementia precox in very previous era. Now we call this one as in the which of the following disorder? Yes, the dementia precox is converted into which of the following disorder? I'm waiting for your answer in the comment box. So if you people know that, just do comment here in the comment box. Yes, very nice, Bacho. The correct answer is that is the schizophrenia. Okay, so the schizophrenia previously used to call as the dementia precox. So who called schizophrenia as a dementia precox? Okay, the schizophrenia word is coined by the Eugen Bleuler. Eugen Bleuler is the person who coined the schizophrenia word. The meaning of this schizophrenia is the split mind. Okay, that is the meaning of this schizophrenia. So I am telling the word schizophrenia is discovered by the Eugen Bleuler, and who called the schizophrenia as a dementia precox? Yes, the correct answer is the Emil Kraepelin. Okay, the correct answer is the Emil Kraepelin is the person who called the schizophrenia previously as the dementia precox. So why he called this particular situation as the dementia precox? But the meaning of the dementia precox is very simple. Dementia means there is some changes in the behavior and the memory. That is the dementia. Yes, precox means early onset. Anything which is coming early in the life, that is called as the precox. Okay. For example, consider the puberty should start after the 11 year. The puberty sign symptoms which is coming in the female before the 8 year means that is the called as the uh, precocious puberty. Precocious means the early onset of the puberty. The sign of the puberty in the male which is coming before the 9 year of the developmental age means that is called as again the precocious puberty in the male. Yes, precocious means the early in the onset. Okay, it should occurs after a certain period of the time which is coming early. That is called as the precox or the precocious. Yes, so the dementia precox means the Emil Kraepelin, the person who noticed that some memory changes and the behavioral changes coming in early in the onset, like dementia like symptoms. Usually, dementia will occur after 65 years and 60 years. Yes, but the dementia like symptoms which is coming in the persons of the 20 year, 25 year, 30 years. So he called this one as in the dementia which is occurring in the early onset of the age, that is the dementia precox, the Emil Kraepelin called. But afterwards the Eugen Bleuler came. This is not, he told this is not a dementia precox. This is independently a separate disorder that is called as the schizophrenia, and this is the major mental disorder in the psychiatry. Okay, very importantly, everything related to schizophrenia will study before our exams. Okay, so don't worry. So now I think the question is very much clear. Yes, the word schizophrenia is discovered by the Eugen Bleuler, and the Emil Kraepelin previously he named the schizophrenia as the dementia precox. Now dementia precox is called as the schizophrenia. Okay, hope the concept is clear. Yes, very nice of you all. Okay, so and here is the beautiful 5-second advertisement. Okay, so students, today is the Sunday. Yes, as we announced that in our application Master Nursing Classes app. Okay, it is available in the Play Store. The link is there in the description box. Every Sunday we are giving the national wide free mock test. Okay, so this test is focused clearly on the RRB exams, ESSC CRE exams, and NORCET8 exams. This is in the pattern of the 80 questions of the nursing, some 20 questions from the non-nursing. Okay, which is prepared by the expert nursing officers from the AIMS. So you people can enroll this one. For the enrolling in this particular test, you people have to download the Master Nursing Classes application. The test is live today with the name of the Day 9 Sure Selection Test. Okay, Sure Selection Test Day 9. This is the test which is free and which is live in the applications. Okay, you people can enroll after completing this class. Okay, so yes, and this particular sure selection test is completely focused on the RRB nursing superintendent, NORCET8 and CRE ESSC exams. Okay, so as exam date will announce, we will give the particular pattern of the question papers. Now it is completely focused on the NORCET8 exams as well also. Okay, so very importantly, people have to understand. Okay, yes, the test is get live in the morning 6 a.m. It will be run till 11 p.m. in the night. At the 12 a.m. in the midnight, you people get the all India ranks. Okay, is in our official Telegram group. The Telegram group link is also there in the description box. You people can join after the class. Okay. Yes. Very nice of you all. Here is the next question. Yes. Here is the next question for you all. That is the which of the following is the contraindication for the nasal suctioning in a patient? Okay. Which of the following is a contraindication for the nasal suctioning in a patient? Yes. Very simple question. So I want your answer in the comment box, bachon. Following is the contraindications for the nasal suctioning. So option A is telling that the severe nasal congestion. Severe nasal congestion means the nose is blocked, means we have to clear the nose by the suctioning. That is the correct. This is not a contraindication. This is the indication to do the suctioning. Yes. So option B is telling that complete airway obstructions. Then option C is telling that yes, the gurgling sound from the airway. Bachon, if some secretions is there in the nose, if the some secretion is there in the trachea, so some gurgling sound will come. So again, this indicating that we need to do the suctioning in the patient. Okay, and mild secretion in the airway. That is again. So if mild secretions are there, means the gurgling sound will come. Okay, so these all three are the indications for the suctioning. And remember, very importantly, complete airway obstruction is not a indication for suctioning. If the complete area is obstructed, so we have to go for the intubation, and we have to establish the airway first by intubating the patient, by inserting the endotracheal tube or by opening the tracheostomy. Okay, so the complete airway obstruction is contraindicated for suctioning. So in these particular situations, yes, we have to go for the intubation. Okay, that is the complete airway obstruction. Then what all other contraindications are there in the suctioning? Okay, so tracheostomy suctioning consider, or the ET tube suctioning. So what all are the airway suctioning contraindications? Okay, remember students, patient is in the bradycardia situation and it is symptomatic. Okay, so patient is bradycardia. Let me write a clearly. That is the patient is in bradycardia. It is clearly indicating the suctioning is contraindicated. If we are suctioning in the patient with the bradycardia, means if there is some again stimulation of the vagal nerve, means the vagus nerve is got stimulated, means again the patient will go for the severe bradycardia. So if patient went for the severe bradycardia, means again we have to use for the atropine as a drug of choice. So we don't want the bradycardia to get converted into the severe bradycardia. So the bradycardia is contraindication for the all kind of the suctioning. Very importantly, then come to the very importantly the pulmonary edema. Pulmonary edema. What is pulmonary edema? Yes, what is pulmonary edema? Pulmonary edema is the accumulation of the fluid in the interstitium between the alveoli, that is called as the pulmonary edema. Okay, so these are the alveoli. This is the alveoli. In between the alveoli here, the fluid is get accumulated, means we call this one as the pulmonary edema. So if we are suctioning in the airway, means here it will create the negative pressure. Here it is creating the negative pressure, means this fluid will move into the alveoli. This fluid will move into the alveoli. So again in the pulmonary edema, so we don't want the fluid to move into the alveoli. So in the severe pulmonary edema, the suctioning is contraindicated. Very importantly, you have to know. And in case of the complete airway obstruction, in complete airway obstruction, first priority it will go for the establishment of the airway, that is by the tracheostomy tube or by the ET tube. We need to go for the intubation. Okay, so if we are keep on suctioning, means the airways get blocked, means nothing will come from the inside to outside. Okay, so nothing will come from inside to outside because the airway is completely blocked. So like suctioning is completely contraindicated here. And nasal suctioning is completely contraindicated in case of the facial or basal skull injury. Okay, basal skull injury, and in case of the facial injuries, so while inserting the suction tube, it may enter into the brain. So that is the reason why in the basal skull injury and in the nasal injury and in the facial injury the suctioning is contraindicated. Very importantly, people have to understand that one. Okay, so very important. So then what are the contraindications? Again, we are giving the O2. Okay, so still the patient is hypoxic. Still the patient is hypoxic. What it means? It means again the complete airway obstructions. Okay, so hypoxia despite of administration of the oxygen is also contraindications for the our suctioning. Very very importantly, these 5 points is necessary. So there are many contraindications are there, but in the clinical scenario this is repeatedly asked. So I told all these 5 points. Very importantly, okay, facial basal skull injuries, the nasal suctioning is contraindicated. Complete airway obstructions, go for the intubation. Don't wait for the suctioning and clear airway. Okay, pulmonary edema, it is clearly indicated, contraindicated for the yes suctioning and bradycardia. So patient may get converted into the severe bradycardia because of the vagal nerve stimulation. So don't do the suctioning in the case of the bradycardia. Okay, so then comes to the yes oxygen sorry hypoxia despite of administration of the oxygen. Okay, ಆಕ್ಸಿಜನ್ ಕೊಟ್ಟರೂ ಕೂಡ ಪೇಷಂಟ್ ಇನ್ನು ಹೈಪೋಕ್ಸಿಯಾ ಇದೆ ಅಂತಂತಂದ್ರೆ ಸೊ ಅದರ ಅರ್ಥ ಏನು ಅಂತಂದ್ರೆ this is airway is completely blocked. Okay, so if the airway is completely blocked means again it is completely contraindicated for the suctioning. Okay, so very importantly, yes, so I hope the answer is clear for this one. Yes, yes, okay, the option B is the correct answer. Okay, and severe nasal condition we can do the suctioning, which is not contraindicated. Gurgling, this is clearly indicating we can do the suctioning, it is also not contraindicated. Mild secretion in the airway, this is also indication for the sectioning, which is not contraindication. Okay, hope the concept is very much clear for you. Okay, so here's the next question. Very very easy question and important questions, I used to say. This is the important and very easy questions. All of you will give the correct answer. Yes बच्चों, come on, फटाफट रापेल के तरह उड़ना चाहिए कमेंट बॉक्स अभी. Yes. Bachcho, I'm waiting for your answer. Yes, very nice of you. Okay, so which of the following is ideal storage temperature to temperature range for the most vaccines in the cold chain? Which is the ideal temperature we have to keep the vaccines, okay, to maintain its integrity in the cold chain? That is the very nice of you all of you have given the correct answer. That is the +2 to +8 degrees Celsius. Bachcho, in the options they will give the -2 to -8 degrees Celsius to confuse you. Okay, so no, it is not in the minus, it is clearly +2 to +8 degrees Celsius. Okay, so remember, very very importantly, okay, don't confuse. Okay, if you want you can write +2 to +8 only. Okay, so I didn't mention it here. Okay, people can mention and remember. Okay, very very importantly, it is not degree Fahrenheit. Again they can give the degree Fahrenheit to confuse you, it's clearly degree Celsius. Okay, hope the concept is clear. And yes, so which is the ideal temperature to store the oral polio vaccine? Ideal temperature to store the oral polio vaccine, that is the -20 degrees Celsius. Yes, this oral polio vaccine will be stored in the -20 degrees Celsius because this is the very heat sensitive. Okay, so this is the very heat sensitive. If it is just exposed to any kind of the heat means it will get damages. Okay, yes, the very heat sensitive vaccine is the oral polio vaccine. It is stored ideal in the -20 degrees Celsius. So that is very important, and overall vaccines will be stored between the 2 to 8 degrees Celsius in our cold chain. Okay, so my next question is, what is the cold chain, what is the reverse cold chain? Yes, what is the cold chain and what is the reverse cold chain? What is the reverse cold chain? Yes, from the site of the manufacture, from the site of the manufacture means from the site of the production or the formation to the site of the administration, or we can say site of vaccination, where it will get produces in the like institutes of the vaccines which is certified by the government of India, like Serum Institute of India. Okay, so Bharat Biotech, so that kind of the factories it will get produces. From those factories to the all sub centers in the India, all sub centers, that is the site of the vaccinations will be happens in the PHC level, sub center level, and in the or taluka health level also. Okay, so this is site of the manufacturer to the site of the vaccinations. We need to maintain some very important basic temperature of the vaccines, that is called as the cold chain. Cold chain is the, yes, maintenance of the proper temperature of the vaccines from the site of the manufacturer to the site of the vaccination. This is called as the cold chain to maintain the integrity of the vaccines. Okay, to maintain the integrity of the vaccines. Then what is the reverse cold chain? Yes, what is the reverse cold chain? Reverse cold chain is very important, students. From the periphery, okay, from the peripheral healthcare delivery system to district hospitals or to the state level hospitals. So we are sending some samples. We are sending some samples from the peripheral healthcare delivery system to the district health hospital or to the state hospitals. For example, some child which is having the some paralytic like symptoms, and the male health worker who visited the villages and he noticed that the child is having some paralysis like symptoms. So that particular situation he have to collect the stool sample of the baby, okay, or the stool sample of the child, and he should store the stool sample in the cold box. Okay, so this cold box is containing the, yes, the ice packs. So you have to store the sample in between the cold box, and this cold box, by maintaining the proper channel, he should send till to the district hospital for the testing or to the state hospitals for the testing. So we are sending some samples from the very periphery to the district hospitals or the state hospitals for the what we can say, for the testing purpose. Okay, this is called as the reverse cold chain. Okay, so cold chain is, this is coming from the higher to the lower, but the reverse cold chain means it is going from the lower to the higher. Okay, that is the very basic difference between the cold chain and the reverse cold chain. And the ideal temperature for the all vaccine storage in the cold chain, which is the 2 to 8 degrees Celsius. And the very importantly, OPV, the oral polio vaccine, will be stored for the minus 20 degrees Celsius. Okay, the most heat sensitive vaccine. Okay, very importantly, you people have to consider. Yes, the reconstituted BCG means the BCG, it will comes in the powder form. We are adding the normal saline to dilute the BCG. So after diluting the BCG, yes, so that is the very sensitive to the heat. Okay, so if the examiner is asking which of the following is the most heat sensitive vaccine, in option C people are getting that is the reconstituted BCG and OPV. Means in this particular situation, you people have to choose the answer as the reconstituted BCG. The reconstituted BCG is a very heat sensitive. Then after that, it will come to the, yes, oral polio vaccine. Okay, so if the reconstituted BCG is not in the options, then final answer will be the oral polio vaccine. That is the final answer. Open. Okay, so hope the concept is clear for this one. And here is the next question. I want to answer for this question. Okay, so this is the trending. Okay, this is the trending for all the nursing officers in the AIMS. Okay, in JIPMER and in all major health care delivery systems, they have started training for the all healthcare providers on the HMIS. So they may ask the questions on the HMIS also. Okay, so this is the very simple questions I have brought in front of you all. This is asked in the last previous year. Okay, so these questions, this is trending now. The training has started to all healthcare providers. So that's what I have brought these questions. It may ask in your exams directly. Okay, so which of the following is not a typically component of the HMIS? Yes, first of all, yes, try to give answers. So I will explain everything. Yes, so I'm waiting for your answer. So whether option A is telling that the data collection tool, yes, it is having the data collection tools in the HMIS. Then come to the patient client records, so patient clinical records. All the patient clinical records will be there in the HMIS. Then comes to the, yes, advanced imaging tools. No, the HMIS, it is does not containing the advanced imaginary tools. Okay, so it is containing only that kind of the features where we can store the data of the patient, where we can store the clinical records of the patient, and health reporting and analysis tools also it will be there in the HMIS. Okay, so it does not contains, it is not typically contains the advanced imaging tools. Yes, all of you almost have given the correct answer. So that is option C is the correct answer. Okay, yes, so it does not containing the advanced imaging tools. Okay, it contains all these three, it not contains advanced imaging tools. So now comes to the HMIS full form. Okay, so I will give two options. You people have to say what is the actual full form of the HMIS. Okay, option A is telling that extension of the HMIS full form I am saying bachon. Option A is telling that HMIS means hospital management and information system. Option A, that is the hospital management and information system. Option B is they given health management and information system. So these two options you people may get confused in the exams. I want answer from you all now. Yes, what is the actually HMIS stands here? Hospital management information system or the health management information system? The correct answer is the health management and information system. Okay, so it is not for the hospital management, it is for the client, it is for the health of the patient. Okay, so it stores the records, reports, everything of the patient. This is related to the health management and information system. Option B is the correct answer. Okay, that is the health management and information system. Yes. Yes, clear, bacho. Okay, so here in this particular questions, option C goes to correct answer. That is the advanced medical imaging tools. It does not contain the rest, or it will be content here. Okay, so HMIS stands here as the health management and information system. Hope the concept is clear. So consider this one as a most important. Okay, this is recently asked in the INICET exam. Okay, INICET question. So it is asked in the NORCET 6 also. Okay, this is the NORCET 6 question also. Question on this particular scale only, but the question pattern was different, but the concept is same only. NORCET 6 and INICET exam. This question is came there. Okay, so in modified medical research council dyspnea scale. Okay, in the modified medical research council dyspnea scale, which score indicate that the individual is too breathless to leave the house? Yes, the individual, the person, the patient is too breathless to leave the house. He is unable to come out of his home only because he is getting the breathlessness. So, what grades you will give to this patient based on the MRC dyspnea scale? Okay, based on the modified medical research and council dyspnea scales. So, how much grading you will give based on the patient who is too breathless to leave the house? Yes. So who all are giving the option D as a correct answer? That is the 4 points we can give. That is the correct. Okay. So here is the modified medical research and dyspnea scale. So take a screenshot of this one. Okay. Make in your last minute revision notebook. Okay. So it will help you all in the exams. Okay. So grade 0. Grade 0 is it indicates the patient will feel breathlessness only during the strenuous exercise. He is in the gym. He is waiting the lift of the, yes, the 50 kg 60 kg weight he is lifting, he is doing the strenuous exercise, then only he will feel the breathlessness. Okay, other than he is the normal, that situations will give the grade 0. Okay, so modified medical research council dyspnea scale is the used for the grading the dyspnea. The difficulty in the breathing will be graded by the MMRC dyspnea scale. Yes, is that clear? Clear. Okay, so grade 0 stands here as the no breathlessness except the strenuous exercise. Only during the strenuous exercise he will get the breathlessness, otherwise he will be normal. That is the grade 0. Then comes to the grade 1. Okay, then comes to the grade 1. So breathlessness when hurrying on the level ground or walking up a slight hill. What happens? Yes, the person who wants to go to the duty at the 9 o'clock, he wake up at the 8:30 and he have freshed up and he got only 10 minutes to pick a bus, okay, and reach to his institute. So he is hurrying, he is running, he is walking speed, okay, he is hurrying on the level ground, okay, not like this is what we call as the hilly, okay, slight hilly. So we can say this is the level ground. While walking on the level ground, not on the walking. While hurrying on the level ground, he is feeling breathlessness. That is the we will give the grade 1. Okay, so we will give the grade 1 when we will give the grade 1, that is while slight hilly, he is walking on the slight hilly area and he is hurrying on the flat area. That situations he is feeling breathlessness, means we will give the grade 1. Then come to the grade 2. Very importantly, walks slower than the people of the same age. Okay, so the people of the 18 age, he will walk very speed without any breathlessness. He will walk slowly because of the breathlessness. So this is the grade 2. Walks slower than the people of the same age on the level ground due to the breathlessness. Okay, very importantly, or has to stop for breathe while walking on a own space. Okay, he is walking on his own space, own speed. Okay, so while walking on his own space or speed, he will stop. Okay, for a second, then he will take a breath, then he will move on. Okay, so he will stop for breathing. Okay, he will stop for taking the breath. Okay, so while walking on his own pace, that is the grade 2, very very importantly. Then come to the grade 3. I am highlighting with the, yes, very very other important other pen. This is the important, this is the only they have asked in the NORCET 6. Okay, this is only they have asked in the NORCET 6 exam, very very importantly. Okay, so that is the stops for breathe after walking the 100 meters or after few minutes of on the level ground. Just he walked the 100 meter, then he will stop, then he will take a breath, then he will move on. Okay, so or just a few minutes he have walked, then he will stop, he will take a breath, and he will move on. So this is the grade 3. Okay, stops for the breathing after walking just 100 meters or after walking a few minutes, so on the level ground only. Okay, he is feeling the breathlessness, that is the grade 3. And grade 4 is the question we have asked in the today's MNC class. So that is the, yes, टू ब्रीथलेसनेस टू लीव द हाउस. ओके, सो घर से बाहर जाने के लिए उसको ब्रीथलेसनेस फील हो रहा है. Okay, he is feeling breathlessness to go out of the home only. Okay, so that is only what we call as the grade 4 dyspnea score here. Okay, so hope the concept is clear on the MRC dyspnea scale. Yes, is that clear, bachcho? Clear? Yes, very very importantly. So mark it one as a very very important and note it in your last minute revision notebook, and then just try to revise just before the exam. That will help you in the main exams. Okay, then come to the next question. Okay, so what does the Uttapa sign indicates in the multiple sclerosis? Yes, what does the Uttapa sign indicate in the multiple sclerosis? Option A is telling that a type of the tremor in the hands. Option B is telling that the presence of the nystagmus. Option C is telling that the an normal pupil response to the light. Then option D is telling that a paradoxical contraction of the pupil upon the accommodation. What it indicates? Paradoxical means ulta. सब कुछ उल्टा हो रहा है. क्या होता है? What happens? When we will flash a light over the pupils of the eye, okay, the pupil should constrict. When I flash a light over the eye, the pupil should constrict. Okay, when will be the dim light, the pupils will get dilate. But in case of the multiple sclerosis, because of the some injuries to the our optic nerve, okay, because of the some injury and demyelination of the optic nerve, there should be a paradoxical contractions. There should be a paradoxical contractions means sorry, there is a paradoxical contractions means if you are flashing a light on the pupils of the patient, the pupils will get dilate, means ulta happens here. So usually normally what happens, I am flashing the light on the pupils should get constrict. Now I am flashing light on the patient, yes, the patient eyes, the pupils are ulta dilating. So that is the paradoxical contractions of the pupils. Okay, and transient blindness also it will be seen. Okay, transient blindness means, okay, what happens in the multiple sclerosis, the classical picture is the transient blindness. Transient blindness, the classical picture we can see in the multiple sclerosis. Okay, what it means? It means the vision will get lost slowly for a period of the certain month. For a period of the 6 month, the visions will get start diminish slowly, and he will get completely loss of his visions. So that is what we call the transient blindness. There is two situations. One is the sudden blindness, another one is the transient blindness. Because of this sudden increase in intracranial pressure, because of intraocular pressure, means the pressure inside the eyes, in the glaucoma, there is damage to the optic nerves and there is chance of the sudden blindness. But in the multiple sclerosis, what happens? There is a transient blindness and paradoxical contraction of the pupils when during the accommodation via light. Okay, so these are the very importantly indicating that is the Uttapa sign. What is the Uttapa sign? Uttapa signs are the vision changes in the multiple sclerosis, visual disturbances in the multiple sclerosis, that is called as the Uttapa signs. Okay, hope the concept is clear for you all. Yes, bacho, clear. So one more signs comes in the multiple sclerosis. So what is the name of the sign? I will give the definition. You people have to say the name of this sign. Okay. So this is the patient of the multiple sclerosis. Okay. So I will hold the head of the multiple sclerosis and I will bend it. Okay. I will flex it forward. Okay. I will flex the head of the patient forward. Then he will get the current like sensation over his spine. Okay. Over his spine, the patient will feel the current like sensation and the pain like sensation. Suddenly it is running from the up to the down of the spine. So this kind of the feeling the patient will feel in the multiple sclerosis. So what is the name of this sign? When the flexion of the head, the current passes here, the pain radiates here down to the spine. What we call this one? Yes, yes, very nice, bachon, very nice. This is what a master nursing classes student stands here. Okay, so that is the Lehermitis sign. Okay, what is that? That is the Lehermitis sign. Okay, so that is the Lehermitis sign. Very, very importantly, this is also classically indicating the multiple sclerosis. Okay, so I think all of you know the definition of the multiple sclerosis. Yes, multiple sclerosis is the very simple disease condition, students. So what happens in the multiple sclerosis? This is due to the some age related problems or due to some autonomic autoimmune body related problems. Okay, what happens? So this is our beautiful nerve. Okay, so this is our beautiful nerve. Okay, so this is the axon. So we have very, very importantly axon cell body, and this is the axon terminal. Okay, so these are the axon terminals. These are the dendrites. I hope all of you have know this one from your since from your PUC. Okay, since from your PUC, all of you know this one. Okay, so this is the body, or we can say the soma, and inside the body there is nucleus will be there. Okay, so yes, and this is the myelin sheet or the nerves. So what happens here in the multiple sclerosis? There is chronic demyelination will be there. Some autoantibodies it will comes and it will damage the myelin sheath. This is the our axon. Okay, on the axons, yes, the myelin sheath will be there. Okay, so in between the myelin sheath there is gap. This is called as the node of the Ranvier. Okay, yes, will already entire discussion over the nerve cells is there in the system wise topic in the playlist. I have discussed everything on the nerve system. Okay, each and every topic on the nerve system I have discussed already. If you want, you people can watch the that particular video after this one. Okay, yes. So there is demyelination of the nerve cells in the central nervous system. Okay, so there is the this is the myelin cell. Okay, damaging to the myelin sheath. So we call this one as the demyelination. Okay, that is the damage to the or damage to the myelin sheath. That is the demyelination occurs in the our central nervous system. So this may leads to the scar formation. Okay, it may leads to the hardening. Okay, scar formation, or we can say the hardening over the part of the brain. Okay, so this is the part of the brain. Okay, here is the nerve cells are there like this. Okay, so here because of the some damage to the myelin cells, the brains become sclerosed. Okay, hardened. Okay, or the scar formation. So in multiple area there is the scar formation because of the demyelination. We call this one as the multiple sclerosis. This is autoantibody mediated and the age related disease of the nervous system. Okay, this is not happens in the 1 days 2 days, it takes the very lots of the days. Okay, mostly it will be seen after the traumatic head injuries patient. Okay, hope the concept is clear, bachcho. Yes, so these are the dendrites which receives the information towards the nerve cell body. Okay, this is the nerve cell body which is having the nucleus. Okay, so and this is very, very importantly axon which carries the uh, information which brought from the dendrites to the nerve cell body. So axons will carry this information to the another neuron. Okay, so the junction between the one neuron to the another neuron. So that is what we call as the what we call as the Yes, that is the synapse is the gap between the two nerve junctions. Okay, that is the synapse. Yes, so very importantly, you people have to understand this one and very basic thing. Already discussed one in the nervous system videos. So if you want, so you can watch those videos also. It is very helpful for in detail everything, all disorders with nursing management, everything I taught in the nervous system videos. If you want, you can watch those videos. Okay. So hope the concept is clear over the multiple sclerosis. Multiple sclerosis, which causes the transient blindness, is a classical picture. Okay, and Lhermitte's sign, that is the flexioning of the head, which passes the current through from the back of our spine. That's what we call as the Lhermitte's sign. So then come to the our Uttapa signs, where some visual disturbances and paradoxical contractions and transient blindness will be there. So that is what we call the Uttapa sign in the yes multiple sclerosis. Hope the concept is clear. Yes, bacho. Let me come to the one more important and very important thing, that is the autonomic dysreflexia. Mark this one as a very important question. Okay, this is came in your last NORCET8 means the symptoms of the autonomic dysreflexia they have asked, and in the options they have given, that is the hypertension dot bradycardia. Hypertension and bradycardia. This is the correct answer for that question which was asked in our NORCET8. So how it possible? How the bradycardia and hypertension will happen in the autonomic dysreflexia? What is the autonomic dysreflexia? At damage to the which area the autonomic dysreflexia will happen? What kind of the questions they can ask in the RRB on the autonomic dysreflexia? Each and everything slowly, perfectly we will study, because many of the teachers they will avoid these topics because it creates some confusion in the students. So I will try my level best to best to clear this concept with the tricks and tips and the actual concept. So understand the concept and give the best shot in the exams and say I am the student of the master nursing classes. Okay, so first you have to tell the answer for this particular question. Okay, so then I will move for the entire details of the autonomic dysreflexia. So question is very simple, that is the yes, which of the following is the common cause of the autonomic dysreflexia? Okay, which of the following is the most common cause of the autonomic dysreflexia? Option A is the tight clothing. So, bacha, all these four are the common cause. Okay, so among this one, the most common one. Okay, the most common one you have to say. The most common one. Yes, the correct answer is the distended bladder. The distended bladder, which triggers the autonomic dysreflexia. I will tell how it triggers the autonomic dysreflexia and what is the autonomic dysreflexia. Autonomic dysreflexia is a complications of the spinal cord injury at the level of the T6 and above. Okay, so in case the spinal cord injury happened at the T6 and above the T6 means to the T5, T2, T3, T1. Okay, cervical injuries. Okay, this particular area, if there is any spinal cord injury, so there is chance of the autonomic dysreflexia will be there. So the question will ask. Sorry, some throat issue is there. So yes, the question will ask at what level the damage of the spinal cord, where there is a chance of the autonomic dysreflexia will be there. So the damage to the T6 and above, the chance of the autonomic dysreflexia will be there. The clear answer. Okay, the perfect and one answer. Yes, clear, clear. So what happens in the autonomic dysreflexia? Bacho, when the patient comes with a spinal cord injury at the level of the T6 and above, so the bladder is filled and fecal is impacted. The full bladder, okay, the full bladder. Here is the bladder. The bladder is completely full means it have to triggers to the nerves. Okay, it have to triggers to the nerve and the nerve signals should go up like this. Yes, but here is the damage at the T6 level. The nerve signals from the full bladder, it should go like this to the brain, and the brain will initiate the dexterous muscle contractions of the bladder. Then the urine will come out. But here the spinal cord is damaged and the signals is not moving up. Yes, this is the actual problem. Or the fecus means the feces is completely filled in the bowel Okay, so now bowel started to send the signals to the brains, but the signals not reaching till the brain because at the T6 level there is a damage to the spinal cord. Or we can say here there is skin breakdown, or here we can say the bed sore or the pressure ulcer at the sacral region. So now the pain receptor started to send the pain signals above, okay, but the spinal cord is broken and which is not receiving the signals towards the brain. That's what here there is the abnormally reflex will starts. So that is what we call as the start of the autonomic nervous system. Autonomic nervous system, they will show abnormal dis means abnormal reflexes. So this is what we call the autonomic dysreflexia, or another name of the autonomic dysreflexia is the autonomic hyperreflexia. Here the sympathetic nervous system will start activate. Okay, here is the sympathetic nervous system will start activate. Okay, the vessels will get constrict here. The blood vessels will get constrict here, and the constricted of the blood vessels means the blood supply will get reduced. The lower half of the body will get pale color. Okay, lower half of the body, or we can say the below the level of the injury, the body color will be the pale in color, and above because of the yes there is no any signals from the downstream, and some pressure will be increases because of the vasoconstriction. I told here, yes, I told here the vasoconstriction will be there. Because of the vasoconstriction, decreased blood supply and pale body. Okay, vasoconstriction will be there means yes, the hypertension we can see here. Yes, because of the vasoconstriction, where there is a less space, there is more pressure. Okay, so less space is there means the more pressure will be there. So there is the hypertension will be there means the increased blood pressure. Because of this increased blood pressure, the baroreceptors will take actions here. Okay, what is the baroreceptor? What is the baroreceptor? Baro means pressure identifying devices. Okay, receptors. Some receptors there in our arteries of the carotid nodes and in the brain, so that feels the pressure and which sends the signals to the brain. Now the baroreceptors are feeling the pressure in the arteries, and they have started to sending the receptor the signals to the brain, and the brain starts to send the brain starts to send the parasympathetic nervous system impulses down to the body. But the spinal cord is injured here, so unable to send completely down to the body. So means the brain started to activate as a parasympathetic nervous system. Okay, so below the body sympathetic nervous system is activated, above the body parasympathetic nervous system is activated. Below the level of the injury, sympathetic nervous system is activated, above the level of the injury, parasympathetic nervous system is activated. So that is what here we are getting the hypertension because of the vasoconstriction, and here we are getting the yes, the bradycardia means a decreased heart rate because of the activation of the parasympathetic nervous system in the upper body. Okay, so that is the bradycardia and hypertension. This is the classical picture of the autonomic dysreflexia. Very importantly, examiner will ask again in the exams. Okay, so that is the hypertension and bradycardia is the classical pictures. Along with that, here the vessels are dilated because of the parasympathetic nervous system, and there is more pressure. So vessels are dilated and there is more pressure means the blood is directly striking on the brains. Okay, the blood is directly striking on the brains means when the heart pumps, the blood will strike on the brains means there is a thrombing headache will be there. Okay, so the thrombing headache thrombing headache means the pulsatile headache we can say. When the pulse will come, that time thak thak thak, the brain will get pain here. Okay, so the thrombing headache will be there in the autonomic dysreflexia, very importantly. And the above body, the vessels are dilated and the blood is flushed means the flushing of the face will be there in the above body. Okay, bachcho, the flushed face above body above the level of injury, and pale body below the level of the injury. Bradycardia above the level of the injury, and hypertension below the level of the injury, very importantly. And parasympathetic nervous system action above the level of the injury, and sympathetic nervous system action below the level of the injury. So this is the tricks to remember. Okay, so a concept I thought you, the parasympathetic nerve signals won't come towards the down, and the sympathetic nerve system signals won't come from down to the up, because of the damage in the spinal cord at the T6 level. So this is the very important. So the questions will comes like this. How the scenario based question will come like this: you received a patient with the spinal cord injury in the emergency department. When you will assess the blood pressure of the patient, the blood pressure will comes 190 by 60, sorry, 190 by 100. So that is the hypertension. When you assess the patient face, it is completely flushed. When you assess the lower body, it is completely pale. Yes, and some goosebumps will be there. Means there is a piloerections. Means the hairs will get straight over the body. That is the goosebumps. Goosebumps we can say in the general language, or in the medical language we can say the piloerections. Means the erections of the hairs over the skin. Okay, so that is also classical picture. And the patient will complain throbbing headache. Okay, so when you check the heart rate is 50. When you assess the blood pressure is 190 by 100. So hypertension, bradycardia, flushed face, pale lower extremities, and goosebumps. So these are the classical pictures of the our autonomic dysreflexia. Very importantly, so these occurring because of the, yes, these all are occurring because of the some nauseous stimuli. So that is the full bladder, fecal infection, and skin breakdown. So these particular situations which sending the signals, then only the autonomic dysreflexia or the autonomic hyperreflexia is happening. Otherwise, it won't happen. So the nursing intervention matters here a lot of students. What is the primary nursing interventions in the patient with the spinal cord injuries to prevent the autonomic dysreflexia? Means don't allow the bladder to get filled. Means catheterize the patient, continuously eliminate the urine. Okay, so continuously eliminate the urine. Don't allow the bladder to get filled. If bladder is filling only, means it will send the signals. If bladder is not filling, means how it will get send the signals? It won't send the signals. Okay, so don't allow the bladder to get fill the. Okay, so means you have to catheterize the bladder and keep the bladder continuously emptying. Then come to the, yes, the fecal infections. Give some laxatives and the high fiber diet. The fecus will won't get impact there. The fecal will come out easily. So there is no signals. Means very importantly. So we have to eliminate the bladder also. The primary interventions are to eliminate the bladder and eliminate the bowel. Okay, so this is the very important, and we have to stop the some nauseous stimuli. That is the some pain signals also we have to stop by giving the some, yes, cutting the specific nerve, okay, of that particular space. Okay, that is the one thing. And another thing, yes, by the cutting the nerve root which is supplying to the injured area. Okay, this is the also very importantly. But nursing intervention is to allow the bladder to completely empty through the catheterization and make the bowel always, okay, empty. Okay, so don't get it impacted. Okay, don't allow the bladder to get filled, and don't allow the bowel to impact. Okay, so this is the very important. People have to understand over the management, and immediately we have to give the antihypertensive medications, because the BP is very much high here and the vessels are dilated. There is chance of the, yes, rupture of the vessels, means get stroke. Okay, so and some chance of the heart attack also will be there because of the sudden cardiac overload and the decreased cardiac activity. So that is what sudden immediately people have to give the antihypertensives which is prescribed by the physician. Okay, so these are the classical pictures of the autonomic dysreflexia. Okay, remember, very important, very easy, and like with concept. Okay, so that is the very easy questions that may comes in your exams. If you are having the concept is clear, so that is very much clear for you all. Okay, so this tight clothing also, it may send some signals to the injured spinal cord. Again, there is chance of the what we can say autonomic dysreflexia. But in the primary interventions, when the patient comes to the emergency department, first we have to lose the clothing also. So that is the, don't keep the tight cloth also, a very important nursing intervention here. Okay, so don't, and rest all thing, there is the fecal infection, distended bladder, and sacral pressure injuries also we have discussed. So these all are the common cause of the autonomic dysreflexia, but the most common is the distended bladder. So distended bladder is always, we need to keep it empty by catheterizing it one. So that is the very important. And very necessary actions as a nursing officer we have to take on that one. Okay, so the next question is very important and easy. So what should be the, yes, what should be the visible when the baby is properly attached to the breast? So the question on the signs of the good attachment from the breastfeeding. So breastfeeding is such an important topic for our all upcoming exams, bacho. So definitely 2 to 3 questions every exams, every time it will repeat on the breastfeeding. So this is a question on the is the science of the breastfeeding. So now in this question, so you people have to understand and identify. So what is the, yes, what should be visible when the baby is properly attached to the breast? Okay, so what is the sign of the good attachment you people have to identify here? Okay, so option A is telling that the more areola is visible below the baby's mouth than the above. No, no bacho. So what happens actually, the more areola should be visible in the above, not in the below. Okay, yes, yes, the more areola is visible below, they are telling no, they, it should be above. Okay, more areola should be exposed in the above of the mouth, not below of the mouth. Okay, so this option A I am eliminating. Then option B, the baby's mouth is closed around the nipple. No, it should be wide opened. Okay, it should be wide opened around the nipple. Okay, it should be wide opened around the nipple. So this is also I am eliminating. Then option C, more areola is visible above the baby's mouth than the below. Yes, this is the perfect sign of the good detachment. So if the more areola is visible above, if the more areola is visible above, so then we can say, yes, then we can say the baby is attached to the breast perfectly. Okay, so the next is the baby's nipple are curled inward. No, so the nipple should the baby's, sorry, the baby's lips are curled inward. So the lips should be, yes, always turned outward, or we can say everted. Okay, outward. Okay, turned outward, or we can say the everted means, inverted means turning in, everted means turning out. Okay, so like this is the properly sign of the good attachment. But look at this one, the baby's mouth should be wide open around the nipple. Okay, so and the chin should be touching to the breast. Okay, so and nose also should touching to the breast. Very importantly, chin touching to the breast is a sign of the good attachment. And then mouth should be wide open, the mouth should be wide open, and lower lip turned outward. Okay, so this is lower lip, so it should be turned outward, or we can say this should be everted. Okay, this should be everted, lower lip should be everted or the turn outward. So then more areola visible above the, okay, so more areola should be visible above than below the mouth. Okay, so it is a very importantly, more areola means this is the this dark color circle in that in the breast of the woman in the pregnancy. So that is the called areola. So this areola should be more visible above. Okay, and it should be less visible below. Okay, so that is the very important thing. And when we have to start the breastfeeding, yes, that is the proper answer is as soon as possible, or we can say within 1 hour of the delivery the baby should be get breastfeeded. Okay, very importantly. Okay, then when we have to feed, so there is no specific times. So usually we have to feed on the demand. Okay, if the baby is demanding every half an hourly, mother should feed every half an hourly. Okay, so but it is very important to while feeding the baby, mother should feed both uh, hind milk and fore milk both. Okay, so then only the baby's stomach will get full. Okay, so feeding should be done on the demand of the baby, and feed completely on one breast, then go for the another breast. Okay, so one breast should be completely empty, so then go for the another breast. What happens otherwise? Okay, so consider this one is the breast. Okay, so this one is the breast, and so these are the lactiferous ducts which are coming. Okay, the lactiferous ducts are the ducts which getting the milk from the yes, acinous cells to the nipples. Okay, this is the nipple. So these particular lactiferous ducts which are having the fore milk. Okay, fore milk, what is the fore milk? The milk which comes first in the feeding, that is the fore milk. Okay, so this particular part of the ducts which is having the hind milk. Okay, so this fore milk which is containing only less protein but more water. Okay, so less protein and more water. So this is for the satiety value, only thirst will get reduces. Okay, this is for the satiety value, or only the thirst of the baby will get decreases. If people feeling hungry, means you will drink water. Is it sufficient for you? Is it sufficient for you all? No. You people have to eat some snacks, eat some food, so then only it should be satisfactory. So like same to the baby also, the first coming milk, it is having only high in the fluid and less in the protein, fat, carbohydrate and all. So that is what you call as the first coming milk. That is what you call the fore milk. Okay, it is fore milk. Then this second coming milk, these are the hind milk. Okay, the last coming milk, these are the hind milk. Okay, the hind milk is high in the protein, high in the carbohydrate, high in the fats, okay, high in the vitamins, everything. Means it is for the reducing the hunger of the, okay, this is reducing the thirst, this is reducing the hunger. Clear? Clear, bachcho? So then if the mother is started feeding from the right breast, for 5 minutes she fed with the right breast, then she shifted to the left breast. Okay, means she will feed the fore milk from the right, then she again feed the fore milk from the left breast. Only thirst of the baby will get reduces. When she will feed completely this complete breast, then only thirst and hunger both will get reduces, bacho. So that is the very important. Okay, people have to understand, feed completely on one breast, then shift to the another breast. Okay, yes, is that clear? Clear. Okay, so till how many years we can breastfeed to the baby? Yes, till the 2 years we can breastfeed to the baby. But the duration of the exclusive breastfeeding, that is for the 6 month. Okay, 6 month is the duration for the exclusive breastfeeding. What is the exclusive breastfeeding? Exclusive breastfeeding is only feeding, only breastfeeding. That is only mother milk will be provided to the baby, other than the medical indicated medications. Some medications we can give, other than that only breastfeeding. There is no roti, no chapati, no rice, nothing should be given to the baby. Only breastfeeding should be given till the 6 month. Okay, along with those, if any medications are indicated, we can give. Okay, other than that only breastfeeding should be given till the 6 month. That is called as the exclusively breastfeeding. Okay, so till the 6 month. So from the 6 month we will start the weaning. Okay, what is the weaning? Some soft smashed potatoes, okay, crushed bananas, and we can give to the baby. That is the soft things we can give to the baby after the 6 month. That is what you call the complementary feeding or the weaning. Okay, after the 6 month we can give. Okay, till how many years we can allow the baby to breastfeed? Till 2 year baby can breastfeed. Okay, so that is the very important points you people have to understand over the breastfeeding. Okay, and the correct answer for this one should be the signs of the good attachment. That should be option C. The more areola should be visible above the baby's mouth than the below the baby. So this is the a very important concept you people have to understand and identify and mark as a correct answer in your exams. So that brings you a proper result, a rank in your upcoming exams, bacho. So we have discussed the lots of the important thing in the today's session. Okay, so don't forget to give the test. Yes, bacho, don't forget to give the Sunday's pre-test. This pre-test is for all the aspirants who is appearing for the next RRB exams, who is appearing for the NORCET8 exams, who wants to give the CRE ASSC exams. So best practice in the nursing world. So that is given by the master nursing classes, the team of the AIMS nursing officers. They are giving the best questions in the test series. Okay, so do attempt to the test series. Okay, so if you found the content and whatever the teaching given today is helpful, so do subscribe to the channel. Okay, hit the like button, so that helps me. Okay, that boosts me to get more content towards you all. Okay, so hope everything is clear on the today's session. Okay, if you have any doubts, if people can comment in the comment box, I will respond to your doubts. Okay, so we'll meet again in the tomorrow session. Tab tak ke liye jai hind, jai bharat.